Have you ever asked yourself where your back tension and stress knots are coming from? Maybe it's because of a lack of air guitar in your life, but probably not. I'm Dr. Dave, and this is a concept that I love talking about with people, and it gets me amped up, which is why I'm dancing, is where is back tension, especially in the lower back, and stress knots actually coming from, right? So I'm a chiropractor. People would come to me in my office, and they'd be like, it hurts right here, or it hurts right here. Treat me, right? And so the expectation is for the physician to put their hands directly on the spot where there's a stress knot. You go to your massage therapist and you say, no, 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 don't massage over here, it's right here, right? But have you ever stopped to ask yourself where those things are actually coming from? I have a proposition for you. By the end of this video, you'll probably agree with me that it could be coming from orthotics. Could be coming from your orthotics. So let me explain this. This is common day protocols for the medical profession, the chiropractic profession, physical therapy profession, and just even going into a shoe store, that you can get temporary relief by being prescribed orthotics. I'll say that again. People typically have some sort of pain, knee pain, back pain, foot pain. They'll get prescribed an orthotic and they'll feel amazing from it. And there's nothing wrong with that, except for the fact that you may not have been educated that there is a long-term downfall to orthotics. So this is a concept that I had to review very frequently in my practice with people, is that orthotics are very temporary. And I even myself prescribed orthotics, but I would always try to do it from a short-term perspective when possible, when there wasn't something really gnarly going on, right? Either way, you can work towards a certain aspect, and what this video is all about. How can we relieve the root problem of our back tension and our stress knots? And it's simply because we don't get the stride that we're supposed to. When we get prescribed an orthotic, it's because of some sort of pain relief method without the intent of fixing the root problem. And when that happens, when we get prescribed these orthotics and they get put into our shoe, is it actually shortens our stride length. In other words, we don't take as big of steps as we're supposed to. Things become very tight over time, and you may have gotten short-term pain relief with that orthotic. I saw it every day in my office. I could even put just a little piece of felt in someone's shoe, and poof, their disc pain, their herniated disc, and those things would all go away, right? Magic, woof. Looked like the miracle provider, right? But the long-term effects of adding the orthotic is that we get really tight because we don't allow for the natural motion of the foot, and therefore our knees get tight, our hips get tight, and our back gets tight. And this is where chronic tension actually comes from. The lack of movement, period. Lack of movement, period, right? Now complicate that fact by a vast majority of us have to sit down all day long, and our bodies aren't meant to do that. And now even with the surgence of standing desks, you're still standing still. You're not actually moving. So standing desks can be just as dangerous as sitting desks. And then you throw orthotics on top of that, and you have a triple whammy of people who aren't moving to get the tissue, the soft tissue of our back, to actually go through the motions that they were meant to do, right? If we think about this, we were meant to be climbing trees and hopping over boulders and doing all of those sorts of primal things. And when our body doesn't get that, it gets really irritated. It gets pissed off. And this is where a lot of back tension happens from. So what can we do about it? Well, one step is literally working towards getting out of your orthotics. And this may seem like a revelation, and it may seem very difficult because, oh, I'm fearful of my foot pain, I'm fearful of my knee pain, I'm fearful of my back pain. And those are all reasonable fears. However, we have to stepwise train our body to get back into the swing of things. quite literally. And so when we take a look at our orthotics, it's time in the orthotics and time out of the orthotics. In just a simple program where on a daily routine, you're getting out of your orthotics and trying to make your foot functional. Literally, you're only trying to make your foot move a little bit better, and that will start to relieve the tension. Now you put the orthotics back in and you go about your day. Month 2, month 3, you progressively use your orthotics less and less, and over the course of a 3 to 6 month period, you should be able to successfully go without your orthotics, okay? It is a process. It's something that you should focus on. It's something that you should have as a daily routine. It's something that, with the right guidance, can be extremely beneficial to the rest of your body, which makes you healthy the rest of your life. Now, the last thing that people want is to sit down in a wheelchair when they're older and feel like they're wheelchair bound, or they can't get up out of the chair, or we've also always heard of the people who fall a lot when they're older. It's because they've worn orthotics. It's because they've worn thick-soled shoes and their feet don't know how to move. At the end of our 50s, 60s, 70s, in that time frame, we go to stand up, and quite literally our balance system doesn't know what to do with it because our feet are so bad, and that's typically because of orthotics. So that's what we want to try to avoid. Month by month, we want to work towards getting that tissue mobility back, the ankle to get stretched out, the calf muscles to get re-stretched out, get the toes working again, all of those types of concepts, okay? So I'd like to invite you to this program that I've created for this specific reason, right? We want to restore the tissue in a logical sense, and I've developed the program to do exactly that. It's called the DIY Foot Relief Now program. It's a do-it-yourself program, because what I've learned over the years is that everyone should be able to do it themselves. You should be able to, on a daily aspect, do something to improve your health, and especially if you're worried about the long-term consequences of orthotics, and you really want to get those stress knots gone and the back tension relieved, this program is for you. So comment below, reach out to me in any way possible of all the different mediums that you may know me through, and we can just start a chat and a conversation. I look forward to hearing from you. If you have any comments, post them below and I'll try to get back to you.